I was diagnosed with a problem last year in August, end of August, after which I went through a colonoscopy. One day after the colonoscopy, we got to know that it's a malignant tumor, and therefore we went for a consultation. We first went to another hospital for to understand what to do and how to take it forward. Somehow I didn't quite like the response from there. I felt that there was no warmth.
Mrs. Harsimrat Kaur, she presented to us last year, I think August and September, beginning with complaints of passing fresh blood in the stools, and the biopsy for which was positive for malignancy or cancer.
Most of the cancers today are treated with multimodal management, which involves surgery, chemotherapy and radiation, and more so rectal cancer. In an attempt to improve survival, there are multiple ways in which we deliver chemotherapy and radiotherapy to these patients, which could be short course or long course.
Dr. Agrawal also gave exactly the same details of how the treatment would be, similar to that of the first doctor, but the kind of sense of calm that I got, the sense of peace and a very strong faith is what I felt when I interacted with him, and that's why we decided to start our treatment here at Max Hospital, Gurugram.
Now, balancing and finding the right combination for a patient is the art here. When we saw Mrs. Kaur, she had a tumor in her rectum, and it was in the part of rectum which we can remove with surgery without sacrificing the sphincter.
So Dr. Bhuvan Chugh was very patient. He explained the whole process of how the chemotherapy would take place, and I still remember that day I had my parents, my sister and my husband, all of us were here to meet him for the very first time, because everybody is generally very scared when they hear the term chemotherapy.
She underwent 4 months or rather 8 cycles of chemotherapy, and she did have her share of intermittent small problems, that her platelet fell at times, and then she had a slight loss of loss of appetite, a bit of nausea. But I think she's a very, very strong woman, and the way she withstood this entire course.
So of course through the treatment we also had the lockdown going on, and slowly the business was coming back to normal in Q4 last year, 2021. It was very comfortable stay. For me it was like a holiday. I was thinking about it as a holiday, even though I was starting my treatment that day. But it was very comfortable. I never felt that I was actually undergoing a chemotherapy.
Mrs. Harsimrat Kaur is a brave lady. She went through her treatment with a smile, and now she is doing well.
So now she obviously comes to us, and she's on our follow-up, and she is there with us. It's been a pleasure and amazing journey with her.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.